Welcome, everyone. Radioactive iodine is a safe and effective treatment that has been used for more than 80 years, helping millions of patients around the world. In this video, we'll explain its benefits, possible risks, and the exact steps you should follow to protect yourself and your family after treatment. Radioactive iodine comes in two main forms. The most common is a small capsule similar to a vitamin pill that is swallowed with water. It has no taste or smell and is very easy to take. The other, less common form is a clear liquid that you drink with water. It has a metallic taste, but it goes away quickly after drinking water. Both forms are equally effective as they reach the thyroid gland or any remaining thyroid cells after surgery and destroy them safely.
Benefits of radioactive iodine. It provides a permanent cure in most cases of hyperthyroidism. It destroys any remaining thyroid tissue after thyroid cancer surgery and reduces the risk of recurrence. It is a targeted therapy. It works mainly on the thyroid and doesn't affect most other organs. In most cases, treatment is outpatient. You go home the same day. Short-term side effects may include dry mouth, metallic taste, mild nausea, slight swelling in salivary glands, or fatigue. Long-term side effects are rare but may include permanent dry mouth or taste change. In very high doses, there is a very small risk of secondary cancers, though this is extremely uncommon.
Why precautions are needed. Most of the radioactive iodine goes directly to the thyroid tissue or remaining cells after surgery, but a small amount leaves the body through saliva, urine, sweat, tears, and stool. This small fraction can expose others to radiation if they have close or prolonged contact. That's why simple, short-term precautions are necessary to protect children, pregnant women, and those around you. Fortunately, radioactive iodine decays quickly. Half of it naturally disappears from your body every 8 days. After the recommended precaution period, your body will have eliminated almost all of it, and your life will return to normal 100%.
General precautions for all doses. Avoid public transportation or hotels after treatment. If possible, drive yourself home. If you must ride with someone, sit in the back seat as far from the driver as possible and open windows for ventilation. Keep at least 2 meters or 6 feet distance from others. Short contact, like handing an item or brief help, is okay, up to 3 minutes at a time, a few times a day, depending on your dose. Drink 1 glass of water every hour while awake. Use the bathroom as soon as you need to. Men should sit while urinating to avoid splashing. Wipe any spills and flush twice. Wash your hands thoroughly every time. Take a shower daily for the first 3 days. Change underwear and pajamas daily and wash them separately at the end of the precaution period. After 24 hours, start chewing sugar-free sour candy or gum 3 to 5 times a day for a week. This helps activate the salivary glands and reduces dry mouth or inflammation. To prevent constipation, eat fiber-rich foods, stay active, and walk daily. If constipation occurs, use a mild laxative, such as Metamucil. Don't share dishes, cups, or utensils. Don't cook for others during the first few days. Sleep alone, preferably in a separate room or at least 2 meters away from others. Avoid kissing or sexual contact during the precaution period. Low dose, between 6 and 30 millicuries. Used mostly for hyperthyroidism. Maintain a 2-meter distance from children and pregnant women for 1 week. Work. Office or solo work, return after 3 days. Jobs involving direct contact, return after 5 days. Jobs involving children or pregnant women, wait 14 days. Public transportation, allowed after day 3. Sexual activity, safe after 1 week. Sleeping alone, at least 3 days, or 1 week if children or pregnant women are nearby. Hygiene precautions, continue for 3 days. Medium dose, 31 to 100 MCI, used for thyroid cancer treatment. Same precautions but longer duration. Maintain distance from children or pregnant women for 2 weeks. Work. Office or solo work, return after 5 days. Jobs with close contact, after 7 days. Jobs with children or pregnant women after 14 days. Public transportation, allowed after 1 week. Sexual activity, after 2 weeks. Sleep alone for the first full week, 2 weeks if children or pregnant women nearby. Don't prepare food for others for the first 5 days. Hygiene precautions continue for 5 days. High dose, 100 millicuries, used for advanced thyroid cancer. Continue distance precautions for 3 weeks. Sleep alone for 3 weeks. Avoid sexual contact for 3 weeks. Office work, not before 2 weeks. Jobs with children or pregnant women, wait 3 weeks. Public transport, avoid for first 2 weeks. Don't cook for others for the first week. Hygiene precautions continue for a week.
Travel. Avoid flying until your precaution period is over. Airport scanners can detect small amounts of radiation for up to 3 months, so better to avoid travel for 3 months. If you have to travel after the precautions period, carry a doctor's letter confirming you received radioactive iodine treatment for 3 months.
At home. Keep physical contact short. Avoid long hugs or close contact. Don't share personal items like toothbrushes or razors. Clean your phone and remote control regularly. Keep windows open for good ventilation. Don't hold children in your lap or kiss them until the precaution period is over. Food preparation. Don't prepare food for others during the precaution period, especially for children and pregnant women. If you must, wear gloves and wash your hands thoroughly. Don't taste food with a spoon and put it back. Use your own washable dishes and utensils. Avoid disposable plates and cups to reduce radioactive waste. Pets. Don't let pets sleep in your bed during the precaution period. Avoid long cuddling or close contact. You can feed them briefly, but wash hands before and after. Let someone else handle litter boxes or walks if possible. After the precaution period, contact is completely safe again. Pregnancy and fertility. Women. Small dose, delay pregnancy 6 months. Medium or high dose, delay pregnancy 12 months. Stop breastfeeding before treatment and don't resume afterward. Men. Small or medium dose, delay fathering a child for 3 months. High dose, delay for 6 months. After these periods, fertility returns to normal and conception is safe.
Waste disposal. A small amount of radioactivity may remain in tissues or materials temporarily. Use washable items instead of disposable ones. If you use disposable tissues or gloves, seal them in a sturdy plastic bag away from children and pets. After 3 weeks, the radioactivity decays naturally, and you can throw them in normal household trash. Never burn or dispose of them early.
Summary. Millions of people have been safely treated with radioactive iodine for over 80 years. The iodine leaves your body quickly. With a few simple precautions, radiation exposure to your family is extremely low. There's no evidence of harm to others. After the precaution period, your life returns fully to normal. By following these steps, you can protect your loved ones and stay confident that they're completely safe.